Uterine fibroids are benign, non-cancerous growths that develop in the muscular wall of the uterus. They are extremely common, affecting up to 80% of women by the age of 50, and can range in size varying from small to large fibroids. Common symptoms include heavy or prolonged menstrual bleeding, pelvic pain or pressure, frequent urination, constipation, lower back pain, abdominal bloating, and in some cases, infertility or pregnancy complications. Traditional options include medications such as hormone therapies or anti-inflammatory medications for symptom control, myomectomy to surgically remove the fibroids while preserving the uterus, and hysterectomy, which removes the entire uterus. Hysterectomy and myomectomy are both major surgeries which require general anesthesia and usually 4 to 6 weeks of recovery. They carry risks of infection, bleeding, and adhesions. Hysterectomy permanently ends fertility, while myomectomy may allow fibroids to regrow. Uterine fibroid embolization, or UFE, is a minimally invasive non-surgical procedure that treats fibroids by blocking their blood supply with tiny little biocompatible particles. This causes the fibroids to shrink and die off while preserving the uterus. The procedure is performed under conscious sedation and X-ray guidance. We make a small puncture, usually in the wrist or the groin, and advance a thin catheter to the uterine arteries. We then inject microscopic particles that selectively block blood flow to the fibroids. The procedure takes 1 to 2 hours. On the day of the procedure, you will arrive at our comfortable outpatient center, receive light sedation, and undergo the 1 to 2 hour procedure. Afterwards, you will rest in our recovery room and are typically discharged the same day after a few hours. UFE is performed in an outpatient setting with no large incisions or general anesthesia. Most patients return to normal activities within a few days to a week. It achieves significant symptom relief in nearly 90% of cases. After the procedure, you can expect to have cramping and fatigue for 3 to 7 days. This could be managed with medication, along with possible light spotting. Heavy bleeding and pressure symptoms usually improve with 4 to 8 weeks. Maximum relief occurs by 3 to 6 months, and fibroids tend to shrink by 40 to 60%.